Symptoms of pyonephrosis. In its clinical picture, pyonephrosis combines the symptoms of chronic pyelonephritis with urosepsis, and sometimes with the more acute symptoms of acute renal infection. The striking symptoms are usually those of urinary septicemia, mild toxic symptoms if the infection is of low virulence, severe septic symptoms if it is more active. The urine. The urine of pyonephrosis always contains pus. For though the pyonephrosis itself may be closed, the opposite kidney is always infected. If, as is usually the case, the pyonephrosis is open and delivering pus into the bladder, this pus will usually be discharged intermittently. The pus thus delivered is thick, ropey, greenish, and settles to the bottom of the urine in a flat mud, quite different from the pus of the milder renal infections, and notably different from the lighter pus of cystitis. The renal function is always notably impaired, and even the mixed urine is usually watery and of low specific gravity, plate 13. Cystoscopy. This reveals a dilated, distorted ureter mouth surrounded by inflammation, though exceptionally, this inflammation of the ureter may have subsided and its mouth look not far from normal, or a golf hole or retracted tunnel entrance ureter mouth. If the pyonephrosis is discharging pus at the time of the cystoscopy, this pus is likely to appear as a thick white ribbon drooling from the ureter. If ureter catheterization is possible, in spite of the various kinks and scars in the ureter, the urine obtained from the kidney may show a surprisingly large percentage of urea, as high as 1.5%, but the phenylsulfonaphthalene output is always low. The opposite kidney will habitually be found infected. Usually its function will be found gravely impaired, although it has shown no clinical signs of active inflammation. Palpation of the kidney. Palpation of the kidney, which reveals little or nothing in most cases of pyelonephritis, usually reveals a very large kidney, and sometimes a sensitive one if there is pyonephrosis. The increased size of the kidney may be due to the large size of the pyonephrotic sac, but often it is due to the great mass of perirenal fibrolipoma. There may or may not be pain in the loin.